Welcome back. This podcast is a community health initiative brought to you by Frontier Nursing University and the Woodford County Chamber of Commerce to improve community health and increase healthcare awareness. Today's episode is going to be a little heavy. Did you know approximately 2 million adolescents attempt suicide each year? Today we are going to talk about depression and suicide in teens. According to the Children's Hospital Association's Pediatric Health Information System, between 2016 and 2022, children's hospitals saw a 166% increase in emergency department visits for suicide attempts and self-injury among children from ages 5 to 18. Joining me today is Dr. Latoya Lee, who has been on the show before. Dr. Lee is a board-certified family psychiatric-mental health nurse practitioner who practices here in Kentucky and takes a holistic, whole-body approach to medication management and helps patients across various age groups find balance and relief from mental health challenges through compassionate and personalized care. Dr. Lee, thank you so much for joining me.
Thank you for having me again.
So let's talk about depression in teens and children. What does that look like, and what is depression in teens?
So depression in teens, again, will look more like that irritable, loss of interest, decreased motivation, a lot of withdrawal in their room. And then you might see a lot of emotional and behavior outburst or just a change from the person that they were before. Some of that could be hormonal, but some of it we need to think about what's going on with that adolescent or teen. And is it more than just hormones? Is it depression? Because it's a tough time to be a teenager, especially right now. And they have a lot of body changes. They are sometimes having friend changes. We're changing schools. And this is around the time, unfortunately, that we have some of your families that are going through divorce or changes at home.
So how is it impacting? Like when we see depression in teens, physically, what does that look like?
Physically, it could look like they're not sleeping. They're having loss of appetite, very fatigued. And again, you can have some belly aches, headaches, just overall not feeling very well physically. That would be your symptoms.
Okay. As a parent or community member, so whether you're a teacher or a neighbor, what are some of the signs we're looking for? So I know it's kind of like all those symptoms, but
you'll see changes in their personality. So maybe they don't want to play baseball anymore. They used to love playing baseball. Why you don't want to play baseball anymore? They're very more self-critics of themselves. They're starting to put themselves down. They could be crying more. Again, that change of concentration and things like that. And we will start to see that they are declining in school, or they're starting to hang out with different friends. And then you need to start asking why are these things happening?
And if I'm a parent of a teen and I think they're depressed or I think something's going on, what do I do? How do I even approach that? Especially with the teen.
You want to be not very critical. You don't need to, kind of raise your voice and say, what's wrong with you? Again, you need to get on their eye level, find a good time. If that's before dinner, after dinner, in the morning, wherever you and them used to connect, and say, hey, I'm concerned because of X, Y, and Z. I saw that you not hanging out with your friend anymore. I saw that your grades has starting to slip. I have saw you staying in your room more often. Kind of tell me what's going on. Do we need to talk? Do I need to find somebody for you to talk to? Because we're looking for those small changes so that we can prevent any kind of danger to their self later.
And what's the first step in getting them help? Is it seeing a therapist, their primary, seeing
a lot of times they go to
PHMP?
their primary first, and then the primary is saying, hey, this is a little bit more than what I can do. And so then they'll send you to the therapist, or if we are having those thoughts of self-harm, and self-harm could be cutting or burning or thoughts of ending life, they will usually send them to people like me, like to the specialists.
And how do you treat that?
First, we do a great assessment. So I'm trying to see what kind of depression we have. Is it just us laying in the bed crying and sad, or is it that we're having a lot of that decreased motivation, decreased energy, lack of sleep? And if we are having those suicidal thoughts, how seriously are they? At that point, then we're going to kind of see what treatment is. But we also have to get to the root of why. Why is very important, so that way we can discuss it with the therapist. We can discuss it in my office. We can discuss it with mom and dad, but we need to figure out why. Because is this just a situational problem, or is this the start of some mental health that could be genetic, or something that we're going to have lifelong problems with.
And what are some of the most common whys or causes that you're seeing?
Most common is bullying. That's one of the most ones. So they're getting bullied at school, and sometimes not just by peers, but unfortunately by teachers, or they feel the teachers are bullying them. So you have to really figure that out. Other changes is, again, the home life. What if there's something going on at the home, we need to know about it. Next, it will be social media. Social media has been a big kicker on the depression type of reasoning, because they're not only getting bullied online, they are comparing themselves to people that are online. And everything we see online is not normal. Right. It is not real life, but their brains can't process that.
Yeah. How do we as parents prevent the bullying or take control of the bullying before it causes the depression? And same with social media. Like, are there checks that we need in place? Like, kids don't need to be on social media. Like, what is that? What do you recommend?
I highly recommend that you, especially if they have a phone, you need to have a understanding about the phone. You bought the phone as the parent. It's still your phone. You're letting the kid borrow it. So at any time, I should be able to check that phone. At any time. And if you won't let me check the phone, then it is my phone. And I feel like that is some of the gray area that we're in, and we need to make sure that we're being the parent and not the friend.
Right.
And we need to be checking the phone. I call myself, I have a teenager, the FBI. I'm checking that phone every day if I can, because I need to know what's going on. I need to know what's going on at school. Not that I don't trust him, but I need to know what other friends and stuff are saying.
Right. So it's not that you don't trust your kid, you don't trust other kids or other people.
Yes. And it's just a big responsibility for a little brain.
Right.
Right. And they're just, some of them are not mature enough, and they don't really understand. And so you have to be able to talk to your kids about everything, especially when we're talking about the teenage years. And there's different apps that you can get. There's different phones that you can get for your child, so that you can monitor it. And I highly recommend them. You can Google that. There's one called the Bark app, and you can see what happens on your kid's phone and who they're talking to. Because even at nighttime and even during the school day, they're getting all this sent to them, and people think it's funny to take pictures during school, and then the pictures get circulated around the school. And then what happens? They're anxious. They're sad. They don't want to go back to school because so-and-so's made fun of them. And then if they put it on social media, it's just a snowball effect. And kids don't understand at that point that eventually it's going to go away. But at that moment, it's so catastrophized. And so
Right.
they're feeling like it's the end of the world.
Mm-hmm.
And so that's what kind of sparks a lot of the depression, because they think it's the end of the world. Everybody's talking about them, because in middle school especially, you just want to be like everybody else. You don't want to be called out.
Right.
And so that's the majority of my patients that I see with a lot of depression. They're in that middle school setting.
So that was actually my next question. Times of life that lead to more depression in kids.
I feel like it is that middle school age. It is tough. It's very tough. And then the later on, when the 16, 17, 18, that seems to be another
Transitions
thing.
through high school.
Transitions in high school when they start to drive. And then you have all that peer pressure.
Yeah.
And then you also have the pressure of, and I'm even guilty of it too, when they come in. So what are you going to do after high school?
Yeah.
That triggers a lot of depression, because we're asking this 18-year-old, what do you want to do for the rest of your life?
Yeah.
And some of them take that very personal. And so then they're trying to just like figure it all out. Or you have the ones that, if it don't go this way, my whole world's going to end.
Right.
So it's just very much a high balance, or fine balance, of knowing your kid. And we're putting a lot of pressure on our kids right now in this day and age.
Yeah.
And I think that as a society, we're not doing very well with that.
Isn't that the truth? I think about that all the time, about the amount of pressure and stress and the schedules we're putting on our kids.
Exactly. And that, I mean, even my kids, we play multiple sports. We're in school, and I'm like, Latoya, you got to take it back. You have to think about what's going on, and is this too much for your kids?
So something you said earlier, looking out if your kid loves baseball and they're suddenly not wanting to play. So part of it could be red flag, but also it might be a light bulb. Like,
yes,
hello, they need to take a step back.
Yes, it could be that, oh, well, this is not going to pan out. This was my dream. What am I going to do now? Or it could be, I don't really find any enjoyment in this anymore, because maybe the coaches and things like that are putting too much expectations on
Right.
And
that could solve any.
Yes. So you have
problems.
you just really have to have that open communication when you have an adolescent. It's a fine balance, and research has showed that being more of that negative parenting style even increases depression chances for your kid.
So I'm hearing not being reactive.
Which is very hard, because again, you're going to have those hormones, right?
Yes, yeah.
And so it's just really a fine balance, and you don't want to be their friend, but you don't want to be a dictator as well. And so you have to figure out what works for your kid, but having that open communication and having that relationship is what I always highly recommend for all my parents.
Yeah. So if I'm a kid, I'm a teen, and I think I might be depressed, I'm afraid to tell my mom because I don't want to upset her.
Yeah.
What do I do?
So a lot of schools have a mental health component built into their online, like their Canvas or whatever they do at school. And you can reach out through there.
Okay.
Of course, a lot of kids know how to do the Google, right? And so you can Google mental health, and all these resources come up. But if we're talking about suicide, we could always call 988. That's the national hotline for suicide. And I make sure that all my teenagers have that, as that is always a resource. That does not mean the people are going to come get you, but it is going to help you process what's going on. And I know that there was a huge initiative during the Biden-Harris administration, and they have put in a lot of resources and money into the school funding for mental health. And I think that's why we're seeing that a lot of the kids know that they can go to a special site at school and send that they need help. And it's a very private thing, and they'll be contacted. And a lot of the schools have psychologists and therapists on site now.
Can a kid call you directly, like your office directly, or do they need a parent to do that?
Unfortunately, here in Kentucky, yes, you need a parent. But the parent just has to consent. And after that, they don't have to always be in the office. Other states have different rules.
Right.
What I learned just this week, as I've been here on campus at Frontier, is that in Oregon, the consenting age, especially for mental health, is 13. So I highly encourage any adolescent to do that research of wherever you're at right now and to see what age you have to be to take care of your own mental health.
Okay, so having that school resource is super important.
Yes,
if they need to.
Yes,
perhaps
and more than 90% of schools have that now. So that's why I bring that up, because a lot of they are also already spilling it into the elementary and for the 4th and 5th graders.
Okay, as we're approaching summer, school's out. What do we do for our kids when they're home alone, and especially if there are things that are stemming from family life?
Exactly. And so for those students, hopefully they've already been kind of flagged at school and has some of those resources, but they need to figure out who their support person is, who your person is that you can talk to. And again, parents need to make sure that they're not isolating all the time, that we're not on social media all the time. If they were to come see me, I give them workbooks, mental health workbooks. Okay. So that's something that we can work on, but we need to figure out what makes you tick, what makes you happy, and those type of hobbies and things like that. Because what that does is it makes your own dopamine. Dopamine is your happy, is one of your happy neurotransmitters in your brain. So if you like to go outside, we need to get you outside. Plus, that's also going to give you vitamin D. Vitamin D helps with energy and things like that. So if you're going to be home all summer, let's make sure that they're not isolated. Let's make sure that they have somebody to talk to, or to really in adolescence they don't play but hang out with. Just having that person is going to be the world of difference. And
as community members too, noticing those kids and making sure that they know that you are there for them. As neighbors, as friends.
And that's one thing. It takes a community to raise a kid, right? And so hopefully that person has, neighbors and things like that. And we just need to listen. If somebody comes up to you and thinks they're concerned about your kid, take it into consideration, talk to your kid, and because the best thing for that kid is to figure out what's going on and see if we can get them some help.
Yeah. Any final thoughts?
Just know what your state resources are, of where you're at, and especially for kids. They're so tech savvy these days.
Yes.
And there's even podcasts. There's podcasts out there for adolescents and mental health. Look those up. That's something that YouTube channels. There's all kinds for kids.
And there are ways to cope on your own. So like the Calm app, I know we've recommended that on the show before.
The Calm app, yes, that's definitely a good one. The mindfulness, there's a mindfulness app for adolescents, and all they have to do is put mindfulness on their phone. But also those coloring books and things. I highly recommend them. I always have them in my office and give them a couple sheets if they don't have any. But just keeping that mind active and not so much on the computer and the video games and the social media.
Well, thank you so much for joining me today for this.
Well, thank you for having me.
Thank you for joining us for today's episode. If you or someone you know is dealing with a mental health crisis or suicidal thoughts, please call 988, and we'll see you next time. This podcast is brought to you by Frontier Nursing University and the Woodford County Chamber of Commerce and is part of the What's Up Woodford network.